Let me ask you something that might genuinely change how you think about your blood pressure from this moment forward. What if the most effective tool for managing your cardiovascular health has been inside your body this entire time? Not in a pharmacy, not in a supplement aisle, not in a prescription bottle, but in the simple, automatic act you perform roughly 20,000 times every single day without thinking about it once. Your breath. I have spent more than 2 decades working with patients in internal medicine and cardiovascular care. I have sat across from hundreds of people who were frustrated, exhausted, and quietly frightened. People who were doing everything they were told, taking their medications, watching their salt, showing up to every appointment, and still feeling like their body was working against them. Fatigue that pressed down on them by mid-afternoon like a slow, invisible weight. Dizziness that hit them the moment they stood up from a chair. Leg cramps that pulled them out of deep sleep at 2 in the morning. A growing list of side effects that felt less like treatment and more like a trade they hadn't fully agreed to. What almost none of them knew, and what I want you to understand before this ends, is that their bodies were already equipped with a built-in pressure regulation system. A biological switch that doesn't require a prescription, doesn't cost a single dollar, and can be activated in under 10 minutes. The research supporting it has existed for decades. The mechanism is well understood, and yet it almost never comes up in a standard 15-minute clinical appointment. That gap bothers me professionally and personally. So let me tell you what 7 consistent days with this approach can actually look like. You wake up in the morning, and instead of that familiar tightening across your sternum, that low, constant bracing that's become so normal you've stopped registering it as unusual, there's something different, something that feels almost like spaciousness in your chest. You reach for your blood pressure monitor, the one sitting on your nightstand. You check the number, and for the first time in longer than you can clearly remember, what you see makes you exhale slowly in something close to relief. That is not a sales pitch. That is not manufactured hope for the sake of keeping you watching. That is a description of what becomes physiologically possible when you learn to deliberately activate your parasympathetic nervous system, using a skill that already belongs to you. But I need to tell you something important before we go further, because I've watched genuinely motivated people practice these methods for 2 solid weeks and see almost no movement in their numbers. Not because the methods failed them, because they were missing one specific factor, a factor I'll explain in detail before this ends. If you skip that piece, you could do everything else correctly and still wonder why nothing is changing. I won't let that happen to you. 3 techniques, all supported by peer-reviewed research. Simple enough to use anywhere, at a desk, in a parked car, in a waiting room. Clinically powerful enough to shift your pressure by 10 to 15 points within a single session when applied correctly. Let's go through each one. The first method has a name most people have heard without fully understanding it. It's a 4-count inhale, a 7-count hold, and an 8-count exhale. A structured breathing pattern developed and studied extensively by a Harvard-trained physician who spent the better part of his career investigating the autonomic nervous system and its direct relationship to cardiovascular function. To understand why this works, you need a basic picture of how your nervous system governs your blood pressure moment to moment. Your body operates in 2 primary states. The first is a high-alert, stress-activated state. In this mode, cortisol and adrenaline flood your system. Your blood vessels constrict. Your heart accelerates. Your entire vascular structure tightens as though bracing for a physical threat. The second state is a recovery and repair mode. In this mode, blood vessels soften and expand. Heart rate slows. Blood pressure drops. Your body finally gets the signal that it's safe. When someone has persistent high blood pressure, their nervous system is effectively stuck in that first mode, running on high alert continuously, even during sleep, even during quiet moments at home. And the particularly cruel aspect of this cycle is that chronically elevated pressure gradually degrades the very pressure-sensing receptors your body relies on to bring itself back into balance. The self-correction system erodes under the weight of the very problem it was designed to solve. The structured breathing pattern interrupts that cycle, and the specific counts are not arbitrary. The 8-count exhale is the functional core of the technique. A slow, controlled, extended exhale directly activates the vagus nerve, a structure that runs from your brainstem, through your throat, branching through your heart and lungs, and reaching all the way into your digestive system. It is effectively the main communication line of your parasympathetic nervous system. When you exhale with deliberate slowness, you stimulate that nerve. The vagus nerve signals your heart to reduce its rate. Your blood vessels receive a chemical and electrical signal to widen. Vascular resistance decreases. Pressure follows. The 7-count breath hold between inhale and exhale allows carbon dioxide to accumulate slightly in the bloodstream. This matters more than most people realize. Carbon dioxide in the right concentration acts as a direct vasodilator. It signals the smooth muscle tissue wrapped around your arterial walls to release tension, to stop gripping, to open. Your vessels have been clenched. Carbon dioxide gives them permission to let go. Here is the practice itself. Find a position where your spine is reasonably upright, or lie flat if that's more accessible. Place the tip of your tongue against the ridge of tissue just behind your upper front teeth and leave it there for the entire exercise. This creates a subtle resistance in the airway that encourages slower, more controlled breathing and reduces the instinct to gasp or rush between phases. Begin by exhaling completely. Empty your lungs. Don't start from a partially full position. You want a clean starting point. Then close your mouth and inhale through your nose for 4 counts. Hold for 7 counts. Exhale through your mouth, slowly and steadily, for 8 full counts. That is 1 complete cycle. Do 4 cycles consecutively. Nothing more when you're beginning. Some people feel lightly dizzy during the first few sessions. That is completely normal. It reflects a carbon dioxide balance your body hasn't experienced after what may be years of shallow, tension-driven breathing. Practice this 4 times daily when you wake sometime at midday, in the evening, and directly before sleep. The pre-sleep session is not negotiable. Research from major European cardiology institutions has consistently shown that blood pressure elevation during nighttime hours is more predictive of serious cardiovascular events than daytime readings. That final session before bed is your most important insurance policy. Treat it that way. A study conducted at a major American research university followed patients with early-stage high blood pressure through 8 weeks of this practice. No dietary changes, no added exercise, just this breathing method applied consistently. Average systolic pressure dropped by 11 points. In cardiovascular medicine, a 10 to 12-point reduction in systolic pressure is considered a clinically meaningful therapeutic response, the kind of number that changes a physician's recommendation about medication dosage. The second technique carries some of the most rigorous cardiovascular research literature of the 3. It's based on a principle that most people outside of clinical research have never encountered. Every biological system has a natural operating frequency, and your cardiovascular system is no exception. Your heart rhythm, your blood pressure regulation mechanisms, and your respiratory rate are all designed to synchronize with one another. And there is a single breathing rate that produces that synchronization most effectively. 6 complete breath cycles per minute. Researchers investigating heart rhythm coherence, the synchronization of cardiovascular and respiratory rhythms, found that breathing at 6 cycles per minute causes your heart rate pattern and your breathing pattern to lock into alignment, like 2 pendulums swinging in the same arc. When that coherence is established, something measurable happens throughout your entire cardiovascular system. Stress hormones drop. Blood pressure stabilizes. The electrical signal your heart sends through your vascular network becomes regular and consistent rather than erratic and unpredictable. But the most significant finding connected to this approach involves something called baroreflex sensitivity. Your baroreflex is your body's internal blood pressure thermostat. When it's functioning as designed, your pressure is maintained within a healthy range through thousands of tiny automatic corrections every single hour, adjustments you never feel and never consciously make. In people with persistent hypertension, this thermostat has been gradually worn down. Years of chronic stress, fragmented sleep, and the relentless low-grade alert state that contemporary life generates have blunted its sensitivity. This breathing technique doesn't just produce a temporary calming effect. The research shows that 6 weeks of consistent daily practice produces measurable restoration of baroreflex sensitivity in people with elevated blood pressure. You're not merely feeling more relaxed. You're literally rebuilding your body's capacity to regulate itself. The thermostat is being recalibrated. The practical execution is simple. 1 smooth inhale for 5 counts. 1 smooth exhale for 5 counts. No pauses between them. No holds. Just a continuous, even wave of air moving in and then out. The quality that matters most in this practice is evenness, not depth. Don't try to take the largest breath your lungs can hold. Let the volume be natural. What you're optimizing for is a perfectly steady rhythm, because irregular timing breaks the coherence pattern. Consistent timing builds and deepens it. Set a timer for 5 minutes. Practice twice daily, once in the morning, once in the early evening. If you want to maximize the cardiovascular benefit, practice 15 to 20 minutes after eating. Your vagal tone is naturally elevated during digestion, and that elevated baseline amplifies everything the breathing can do. A study published in a major peer-reviewed journal focusing on cardiovascular medicine followed hypertensive patients through 6 weeks of daily practice using this method. Average systolic pressure reduced by nearly 13 points. The strongest responders in the study were men over 50 with established hypertension, a population whose cardiovascular systems responded most powerfully to exactly this type of consistent, rhythmic input. Your nervous system is not broken. It has been trying to regulate itself. It has simply been missing the right signal delivered at the right frequency, with enough consistency for it to respond. This technique is that signal. The third technique is the most useful for moments of sudden pressure, when stress arrives hard and fast, when you feel your chest tighten and your heart accelerate, when your instinct is to reach for medication because something needs to happen right now. It comes from a tradition of yogic medicine and involves alternating the nostril through which you breathe in a structured pattern. The name in classical Sanskrit translates roughly to channel purification, and while its origins are ancient, the physiological mechanism has been thoroughly examined by contemporary researchers. Here is what the research shows is actually happening. Your 2 nostrils are not symmetric structures, and they are not passive passages. They alternate in dominance roughly every hour and a half through a documented process called the nasal cycle. Most people are completely unaware of it. But researchers have established that each nostril preferentially activates a different hemisphere of the brain and a different branch of the autonomic nervous system. Breathing through the left nostril activates the right brain hemisphere and the parasympathetic branch, the calming, restorative mode. Breathing through the right nostril activates the left hemisphere and is associated with the alert, aroused state. Alternating nostril breathing produces rapid, rhythmic switching between both sides, creating what researchers describe as a neurological reset of the autonomic system. You are essentially rebooting the operating system of your stress and recovery mechanisms in real time. A study published in a respected international research journal showed that 5 minutes of this technique produced statistically significant reductions in both systolic and diastolic pressure, even in participants who were measured immediately following a standardized stress protocol specifically designed to spike their numbers. 5 minutes. After deliberately induced stress. Sit with your spine upright. Rest your left hand open on your left knee. Bring your right hand to your face. Use your thumb to close your right nostril and your ring finger to close your left. Inhale slowly through your left nostril for 4 counts. Gently close both nostrils. Brief pause, 1 or 2 counts. Release your thumb and exhale fully through your right nostril for 4 counts. Then inhale through your right nostril for 4 counts. Close both nostrils. Brief pause. Release your ring finger and exhale through your left nostril for 4 counts. That is 1 complete cycle. Continue for 5 minutes. If you lose track of which nostril you're on, and nearly everyone does in the first few sessions, simply stop, take a normal breath, and restart from the left nostril. There is no penalty. This is not a performance. It is a reset. Now, the critical factor I told you about at the beginning. The piece that determines whether everything else actually works. These 3 techniques operate by activating your parasympathetic nervous system and signaling your blood vessels to dilate. But that signal requires a specific mineral to complete the process at the cellular level. Magnesium. Magnesium is the mineral your body uses to open the calcium channels in the smooth muscle tissue wrapped around your arterial walls. When those channels open, the muscle releases, the vessel expands, and pressure drops. That is the mechanism, and it requires adequate magnesium to function. Research consistently suggests that a significant majority of adults over 50 are running below optimal magnesium levels. Not because they're being careless, because modern agricultural soil is mineral depleted, and the modern diet relies heavily on processed foods that have lost these minerals in refinement. The sign that this applies to you is specific. You practice consistently, genuinely, not occasionally, for 2 or 3 weeks. You feel calmer. Your sleep improves noticeably. Your resting heart rate may drop a few beats, but your blood pressure numbers barely move. That is not a technique failure. That is a mineral deficiency creating a ceiling on your vascular response. You're activating the right system, but the system can't complete the action because it's missing the raw material it needs. Ask your physician for a red blood cell magnesium test, not the standard serum test, which is unreliable because your body continuously pulls magnesium out of tissues to maintain stable blood levels even when cellular stores are genuinely depleted. The red blood cell test measures what's actually inside the cells where the mineral does its work. And here's the final piece, the one that separates people who build lasting results from people who feel motivated for 2 weeks and then quietly stop. Do not try to practice all 3 techniques simultaneously from the beginning. That feels like commitment, but it works against the way your nervous system actually adapts. Your autonomic system builds new regulation patterns through repetition. The same stimulus, applied consistently, over enough time for neural pathways to strengthen. Research on vagal tone development shows that measurable changes in heart rate variability begin to appear after approximately 14 days of regular practice. If you're rotating between 3 different methods every day, each technique receives only a fraction of the repetitions required to trigger adaptation. The signal gets spread too thin. Your nervous system begins the process but never fully commits to the new pattern. The sequence that works is layered and deliberate. For the first 2 weeks, use only the 4-7-8 technique for times daily, morning, midday, evening, and before sleep. Let it become automatic. Let your body stop consciously counting and simply breathe. In week 3, maintain that practice and introduce the 6-breath resonance method twice daily. The 2 reinforce each other, one building the acute parasympathetic response, the other training the deeper cardiovascular coherence. From week 4 forward, keep both and add the alternating nostril method as your on-demand tool for acute stress, sudden pressure elevation, or any moment when you feel your system spike and need a reset within minutes. One final thing, and I want to be as clear as possible about this. If you're currently taking prescribed medication for high blood pressure, do not stop taking it. Do not reduce the dose. Do not make any change to your medication without a direct conversation with your physician. Stopping antihypertensive medication abruptly can cause a rebound elevation that is more dangerous than your baseline numbers. Please do not do that. What this practice does is work alongside your current treatment, not against it. It addresses the nervous system drivers of elevated pressure that medication alone was never designed to reach. Over time, with consistent practice and documented results, many patients reach a point where the data in their blood pressure log becomes the foundation of a new conversation with their doctor. The physician looks at the trend, looks at the numbers, and says the words that feel like progress. Let's try a lower dose and see how your body holds. That conversation happens because of data, your data, numbers from your own monitor, your own body, your own consistency. Here is your starting point for tomorrow morning. Before your first practice session, measure your blood pressure and write the number down. Do 4 cycles of the 4-7-8 technique. Measure again immediately after. Record that number too. Do this every single morning for 2 weeks. Keep the log somewhere you'll actually see it, a notepad on your nightstand, a note on your phone, whatever works. After 14 days, you'll have something more powerful than any amount of clinical information I could give you. You will have proof from your own physiology. And that proof becomes the most durable motivation you'll ever find, because it transforms this from something you're trying into something you know.